Hi, my name is Steve Pratt, and I am the Chief Executive Officer at United Way of Chatham-Kent. And thank you for joining us for our daily 3 p.m. updates. And joining me today is Cathy Taylor she's the Executive Director of the Ontario Nonprofit Network, and Patricia Peters, who currently has a double role in terms of she's our Director of Resource Development with United Way, and she also helps to coordinate our local Chatham-Kent Nonprofit Network. And with everything that's been happening COVID-19 related, we know that there's been some significant impacts that have happened in our nonprofit sector. And we've recently collaborated with the Ontario Nonprofit Network and through our Chatham-Kent Nonprofit Network to really kind of figure out what was happening, how our local nonprofits were being impacted, and also how does that look on the provincial side of things. And one thing that we learned through our data is that what was happening here locally in our smaller community is happening right across the province. Mm-hmm. And so now I'd like to invite Cathy Taylor to share with us a little bit about what we learned. And perhaps, Cathy, if you'd like to start on the flash survey and why that was needed in itself, that might be a good place to kind of get things started. And I'll start to share the screen so we can have our slides up as we go.
Great. Thanks so much, Steve. It's a pleasure to be here in Chatham-Kent. We did a flash survey of nonprofits and charities in Ontario. We had 500 organizations fill out our survey for us so that we could get a pulse of what was happening on the ground in communities across Ontario, and that we could really ground the advocacy work we were doing with government, what the voices and experiences are from the sector. So it was really helpful for us to hear directly what organizations were facing and how they were doing. And this survey was done sort of week 3 of the shutdown. So it's an early test of where organizations are at right now. And we'll probably have to do future surveys in the future.
Excellent. And so I guess what are some of the things that ONN had learned through the survey?
Yeah, such a good question. I mean, what we heard were that organizations by and large were facing a financial cliff. The situation's quite dire for most nonprofits and charities in the province, and that relief and supports can't come soon enough. We know that over a fifth have already closed their doors. Only 3 weeks in had already closed their doors and were unsure if they were going to be reopened. That 75% had reduced fundraising revenues already, and over 1/3 have already had to lay off staff or reduce hours. So we expect that those numbers will increase over the duration of the emergency closures and the future implications of COVID-19.
Yes, and I can share that definitely locally we've seen that too, and a lot of it has to do with the fear of contagion of the virus itself, where workers are basically refusing unsafe work, or volunteers are. A lot of our volunteer base was 70 plus, who can kind of be at high risk of COVID, and so we've seen a lot of folks that have made the decision to step back and support things virtually, and really. Or in some cases, just not be able to provide support at all. So our local organizations are definitely feeling the pinch. Not being able to have more than 5 folks kind of together in one space has put a lot of strain on our emergency food supply networks and things like that. Definitely a lot of issues that have come through that. But again, for folks making those decisions to not want to potentially expose their family or loved ones to the virus, they definitely have stepped away. Not being able to do special events, number of phone calls from local organizations voicing that concern as well. And being able to even get fundraising revenue from bingos and things like that. It's really it's been a challenge.
Mm-hmm, mm-hmm. Well, it really feels like a triple threat. So the reduced revenue from fundraising events, operational challenges. So how do you suddenly, meet the needs of your beneficiaries virtually or in small groups? And then the HR shortages, both from the volunteer side of things mm-hmm. and the human resource side of things when you think of the risk of contagion.
Absolutely. And I guess a little bit more on the education and research.
Yeah, so, just a bit of highlights around 2 or 3 of the parts of our sector. We call them our subsectors in the nonprofit and charitable sector. We have quite a diverse sector, 58,000 nonprofits and charities in Ontario. Many are social services, arts and culture, sport and recreation, education and research. And every sector has been affected already by this crisis, but a few different differentiating points. So for example, the education and research nonprofits, almost half of those have had to lay off or will have to lay off staff, and a third can only sustain their organization for 1 to 2 months with respect to their reserve funds. And so that's a concern for that sector specifically.
Sheesh. And for arts and culture?
Yeah, no, this is a really hard hit sector, partially because 81% of their revenue has been lost in the short term, and that's tickets, fees, fee for service revenue, ticket sales, performance costs. So over 80% of their revenue has been lost. 2/5 of the arts and culture organizations have had to close their doors until further notice. And about a third remain open with changes about how they go around their normal operations. And so for that particular part of the nonprofit and charitable sector, without those types of performance payments, they're basically financially doomed. So there's certainly we're worried about all parts of the sector, and that's also a particular sector that we're concerned about.
Yes, and I know we're going to talk in a little bit about the role ONN is playing in helping to advocate for support for that sector. But health nonprofits.
Yeah, so health nonprofits is completely different beast in the sense that they're open, they're working. You know, our hospices, our mental health support providers, many of your members and connectors locally, 75% have seen a reduction in revenues, though already, and they have a little bit more leeway in terms of how long that they can stay open without extra revenue, but not much, no more than 3 months. And 2/5 estimate that the impact for them is going to be a shortage of between $100,000 and $499,000. So we're talking significant gaps in fundraising and in other types of fees that they're getting. But interestingly, although 83% have experienced a disruption of services, most of them are open and are figuring out and are resilient and creative and trying to figure out those solutions so that they can continue to stay open and continue to meet the services that their organization's mission is focused on.
Yes, and in our conversation with our local hospice, and I don't know, Patty, if you want to jump in on the conversations you had with St. Andrew's residents and our hospice on things being okay now, but in the event of an outbreak, we talked about things are going to look a little bit different.
Yeah, so for sure, Steve, that's one of the things as we touched base with both hospice and St. Andrews was sort of status quo for right now, and they're holding tight. Of course, there's always the conversation about the inability to do their fundraising, which would be gearing up right about now. But so they feel like they're okay right now with the status quo, holding tight, but very protective of their environment so that they don't go into crisis with the virus entering into the facilities there, which of course we know changes the game completely.
Absolutely. And so how about the social services side?
Yeah, so near and dear to your heart, I know.
Oh, very, very much so.
Yeah, so and I'm looking forward to seeing how these numbers play out in terms of Chatham-Kent as well. So almost 3/4 have reduced revenue from fundraising. Spring is a big time for fundraising for social services, as well as all the types of the sector, between golf tournaments and spring galas and the like. 1/5 of those organizations can only be sustained for 1 to 2 months without additional funding. So again, a very short window to stay open. And over 90% of social service providers have experienced a disruption in their services to clients or community because they are frontline services. They are people-to-people contact that support our most vulnerable people. And yet they're not quite first responders. Although they're considered essential, they're not quite first responders. So we heard a lot in our survey about access to personal protective equipment for social service providers, for example, issues around shortages of labor because many individuals would work part-time at a number of organizations in the social services sector, and also concerns around contagion in the workplace. So this sector particularly, this part of the nonprofit and charitable sector has been incredibly affected by the disruption and the crisis, and yet they're the ones that are still open, that are still meeting their community's needs. They're still being as creative as possible to make sure that no one falls between the cracks.
Yes, and it's definitely been challenging in many aspects, and particularly when we look at the ability for financial resilience through all of this. There's huge gaps, and we've been working very closely to make sure that we're understanding through the Chatham-Kent Nonprofit Network, in particularly who they're supporting, and if their services become disrupted, who are we displacing? So we're seeing the role of the community, and we're helping to kind of coordinate what's happening on that front to help our most vulnerable that are at the highest risk of contracting COVID and developing complications or landing themselves in the hospital. It's just like, how can we help keep our most vulnerable healthy, connected, and out of the hospital, and supporting those folks that are providing that service as well. And we definitely heard loud and clear the need for personal protective equipment, and we fully understand that the priority right now is on our healthcare system, because we know locally, Dr. Dax Biondi had been talking about, if our healthcare workers start to become ill and the health system becomes overrun, there is no cavalry to call in, there is no backup, right? It's a global crisis that we're facing everywhere. So we'll be in a very difficult situation there. So how can we make sure that we're keeping folks in the hospital safe, and those are the first responders safe, and then how can we do our part in the community to help folks with isolation pieces and social distancing and all those other kind of supports, whether it's coordinating deliveries of groceries or whatever that might be, just to help eliminate and reduce the number of kind of face-to-face contacts that are happening. So definitely a lot of conversation around that, and what role our social service sector can play through this.
Absolutely.
So now that you've learned all of this, what are some of the things that ONN is helping to advocate for, and some of the changes that we're wanting to, or what voice are we wanting to ensure is heard loud and clear through all of this?
Yeah, there's certainly a number of things that we're advocating for, both with the provincial government and the federal government on behalf of nonprofits and charities. Number one is an emergency stabilization fund or a resilience fund that all nonprofits and charities could apply to, that can help sustain them over the short term and up to a year. We already know there's some great funding announcements that have been made that have been targeted for specific sectors, some funding for senior services, for example, for shelters, for food banks. And in addition to that, we're looking for a broader fund that's accessible to all nonprofits and charities, as well, in addition to the wage subsidy that has been announced by the federal government. We are looking for both a federal and a provincial response to this. A third of Canada's nonprofits and charities are in Ontario. So we know that whatever the federal government does is going to be much needed and helpful, and and we're going to need a provincial response as well. We're certainly talking to government as funders, as well as other funders such as United Way's, community foundations, philanthropic foundations, corporate funders, to have more flexibility in their funding agreements. So to continue to pay for the funding that they have available, to be lenient in terms of reporting deadlines or moving funds between, say, one budget line like travel to another budget line when travel isn't needed right now, and to be as flexible as possible with their funding, so organizations can use the funds that they have for the best possible reason right now, to meet their community's needs. So that's a big one for organizations that do have funding from a variety of sources, to know that their funders have their back, and can support them during that time.
Absolutely. Yeah. And that is one thing locally that we did through our United Way, is that all of the programs that we are currently funding, so we fund on average about 30 different programs and services in the community that support around 40,000 people each year. And one of the first things we did is that we wanted to make sure that the folks that we were funding, it's usually for a specific program, and we've opened that up and saying, use the dollars where they're needed most. What that needs to be. So if it's not the children's bereavement program, and it's providing support to seniors right now to be able to help with the social isolation piece, please do that. And the CRA has been quite good in working to help these collaborative things coming together. So we pulled together a number of the foundations and things like that to try and make a very streamlined, simple application process for some of the emergency funding that's available. And then also on the reporting side, they're very happy with just a picture to be able to kind of prove that, you know, do the due diligence piece on the CRA side, that the charitable dollars were spent on what the, you know, what they're supposed to be, or what they had been requested for, basically, right? So that's about as easy of reporting that I've ever seen in terms of working with any kind of government money, right? So it's really, really helpful on that side. So I think we are starting to see a shift in that, and some of the organizations understanding that, you know, we could use a shared application process for all of this, a really simple application that can be completed in under 10 minutes. When's the last time you've heard of a 10-minute application for government funding, right? So it's really, really good in trying to kind of lighten up all of that and keep it as simple as possible. So there is some work locally happening on that front.
That's so great to hear, because so many of the solutions are locally based. We know that they're place-based. You know, people know people in your communities. Your funders know you. Your local mayors and MPPs and councillors know where to go to for help and how to work together. So the more that we can create those local collaborative structures, the best. But it's such great news to hear that flexibility for organizations on the ground, because, you know, the last thing we want them to do is spend their time on paperwork right now when there's so many needs to be met.
Absolutely.
They're already, as we've already noted, they're already short-staffed or short of volunteers. So actually the next couple of pieces of advocacy we're doing are about the workers in the sector. So to make sure that they have access to the personal protective equipment that they need to do their jobs as frontline service providers. And we're advocating for paid sick leave, which we do not have in Ontario. In addition to some of the changes to EI that are happening federally, a lot of those are temporary changes to get us through the crisis. But it's really been an eye-opening experience to know that many workers, including in nonprofits and charities, don't have paid sick time. And that is one of the building blocks that we need to have in place in order to ensure healthy workplaces going forward.
That's wonderful.
Yeah.
And we talked about definitely the access to personal protection equipment, and that's we're hearing that loud and clear, and making sure we're doing the best we can with what we have available. There's a number of local groups that have come together to create cloth masks, even where, you know, that helps us if we're speaking moistly, but, you know, all that kind of good stuff. But it's really good in terms of the number of folks that are stepping up, wanting to help, and it's just like, what can I do to try and help support the community? So a lot of good local things there. You also talk about access to emergency childcare.
Yes, absolutely. So as you know, there's been some announcements in Ontario about emergency childcare being available for essential workers and first responders, which is wonderful. And a number of the childcare providers are nonprofits themselves. So YMCA childcare centers, for example. And we're advocating for that to be opened up to be so that there's more emergency childcare for essential workers that are in addition to the first responders. So of course, the first responders first, but the essential workers that are working with one-on-one with people with disabilities in nursing homes, in social service settings, in shelters and food banks, they also need access to childcare, which is not available right now. And we have childcare centers that have laid off their staff and they're ready to go. So we are advocating for an expansion of the access to emergency childcare for workers that are deemed essential workers. And finally, we're advocating to make sure that nonprofits and charities are at the table, both locally, provincially, and nationally, when decisions are being made about how our communities are responding and what the economic recovery looks like. Because our sector is a big part of the economy. We employ 1 million people in Ontario, $50 billion worth of GDP in Ontario alone, and we'll be part of the economic solution as well, both as employers, as owners of property, as organizations that buy things, but also because we have a direct connection to the communities that we serve and can provide some great advice. So we're advocating to make sure that nonprofits and charities are part of those discussions that happen around the economic recovery.
Yes, and I can share that locally, as of this morning, we received an invitation, a lot of nonprofit leaders from the mayor's office, inviting us to our local economic recovery task force. So that's it's a message that's been heard. So very good.
That's great. So pleased to see that, and we know that it will make a difference for sure in local communities.
Absolutely. So I guess now maybe we can switch our talk a little bit in terms of if I'm an actual nonprofit and I'm looking for some support. So right now it's definitely not business as usual, and I know that the ONN has put together some fantastic resources in
Oh,
terms of helping them helping nonprofits kind of navigate all the changes that are happening and how to do virtual AGMs and all that kind of good stuff to keep business running as close to normal as possible, knowing that it's not business as usual. So
that's right.
perhaps you can walk us through some of that.
Sure, sure. We have a number of resources that are available to the sector on our webpage. One is just on one page, we have our COVID-19 resources. So everything from mental health support to how to work from home to some virtual tips and techniques, lots of support for the organizations. And then separately, we have a page on provincial government programs, initiatives, and analysis of what's happening at the provincial government. So for example, what nonprofits are considered an essential service is one example, or what some of the emergency orders in Ontario mean for our sector. And then we have a federal analysis page of all the federal programs and what's happening at the federal level that are available to the sector as well under our COVID page. Some of the tools and resources that are really specific are, for example, how to host a virtual AGM, because we did lobby for the provincial government to allow AGMs and board meetings to be held virtually. So we've got a great tool available on that. And we're also doing a series of webinars for the sector, two that we've finished that are on the recordings, and the slides are on the website too, are about remote work for nonprofits and charities, and human resources and volunteer management for the sector. And we are planning and we'll be launching soon a series on financial management for nonprofits and charities. As well as some other topics that will be coming up, and those will be completely free to any nonprofit and charity in Ontario to attend. And all of our resources will always be free on our website, and we have a subscription button to subscribe. Again, subscribing to our newsletter is free as well. For breaking news, for announcements that come, like we're expecting some announcements soon about the Canada Summer Jobs Grant, for example, and a federal stabilization fund. So organizations can get the information they need if they subscribe to our e-newsletter.
Yes, and I know Patty and I can attest to how wonderful that newsletter is. It's a phenomenal resource for sure, and yeah, that's really, really good. And on the Chatham-Kent side of things, for those watching, we did talk a little bit about the survey and the needs analysis that's kind of there, and wanting to know how your nonprofit has been impacted, and if it has been impacted, and are you in need of any type of emergency support. So on the ckgives.ca portal, you can go through, and right on the bottom of the very first page is talking about the ability for community organization support. And there's an opportunity to participate in the needs assessment survey. It takes about 8 minutes roughly to complete. And then there's also an opportunity where we're meeting with other nonprofits, and we're really trying to move from a push-driven response where it's very kind of management by firefighting, if you will, as issues continue to pop up, to a much more of a pull-driven response where it's management through sight and trying to get a good read on the kind of what's happening, and looking at having conversations with folks around very specific issues, whether it be seniors or our homeless population and other kind of vulnerable groups, to just kind of understand, and using the fire analogy, I guess, installing our smoke detectors, if you will, to be able to kind of pick up what's happening, to ensure that we're quick and able and ready to respond as some needs continue to change and develop. And definitely looking forward to any announcements around a stabilization fund. So that's definitely great. And thank you for all the work that you've been doing, Cathy. It's you and the team at ONN are just phenomenal people to get to know and be able to work with. So it's very good.
Thank you
But
so much.
yeah, is there anything else that you would like to share around
Well, I think maybe just a final comment that as we really try and help organizations move from this volatile stage to more a stable stage, from volatility to stability, it's so important to talk about the successes and celebrations. And so many organizations are doing amazing things in their community to keep the morale up, to keep people safe. To shine a light on those that are most vulnerable. And we're just so grateful that nonprofits and charities are there to not just fill a gap, but to actually create the solutions that our communities need.
Absolutely. And Patty, did you have any closing comments that you would like to share?
I do, Steve. Thanks for asking. So I guess to resonate what you were just saying, to echo, we are really grateful, Cathy, for our relationship with you and the nonprofit ONN. Our survey really was sort of came in line after yours, and so to have your results and our results come back and see the similarities just feels like Big Brother is taking care of us in this odd kind of way. I also want to reflect what you said, that we're seeing creativity just brimming, right? We're seeing creativity come in all these magnificent ways where absolutely solutions are place-based. So as I'm reaching out to some of the folks that have completed the survey to gather more information to know how more specifically can we be helping and supporting. You automatically think that people just want money. And what we're finding is that's not the case at all. We just need connections. We need to find out who's got masks, who's got gloves, who's got some software, who might have some volunteer time. Where would we find a group of supply teachers? Do we have a connection there? So it's absolutely the connections that people are seeking and these fantastic creative solutions. And I was just pondering as you were speaking that that notion of celebrating all these successes. And as much as we are all really struggling, we were having a conversation earlier today, Steve, weren't we? The idea that we're all really struggling with this odd bereft isolation issue. But in this very peculiar way, we're getting to know each other in a way that we would never had we been going full speed ahead. So I'm kind of grateful for that.
That's very good. Yes, and we know too that as we've been talking about as well, like the financial need that's happening, as we talked about earlier at the start of the conversation around the triple threat that's happening. We know that while we are working on the connections and doing all of the other stuff, coming together, and it's phenomenal, but definitely there's a financial gap that's occurring because of the inability to fundraise and do all these other things. And we had a conversation at the local Canadian Association of Gift Planners meeting this morning around, okay, well, when the restrictions come up, is everyone all of a sudden going to run out and try and do all their fundraising at once, right? And it's just like, so having these kind of conversations around that, and I think that's where the social stabilization and nonprofit stabilization kind of fund really starts to make sense, and knowing that a lot of these organizations could potentially be in a lot of danger without the ability to earn revenue or be able to fundraise. So again, thank you so much for the advocacy work that you've been doing, and it was really great having this conversation today.
Thank you for inviting me.
Yes.